morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning, and of course, Jim Stallings on vacation, filling in Dave Wilson. And this morning, Dave, Health Talk, sponsored by Mon General Hospital.
Good morning, Kay.
You have nice, sharp blue eyes.
20/20,
I can
might
see
add.
that, and now you're bragging. But
Yes,
there will
I
be
am.
a day that your arms will get short. We're going to be talking about the eyes this morning with Dr. V.K. Raju, an ophthalmologist. And we're going to focus on eye care facts and myths. And there's a lot of them out there, Dr. Raju. Yes, ma'am. Welcome to the show.
Thank
Wow,
you.
where do we begin? Talk about, first of all, eye care. And I just told Dave what great-looking eyes he has. And do we care for our eyes the way we should? Do we neglect them?
Not really, we don't neglect, but we are not aware what is a fact and what is a myth.
Mm-hmm.
When we know what is a fact and myth, that means we are educated enough. I think we will take care of our eyes with less expensive way.
Well, the reason I ask that is because we're all sitting in front of computers all day, most of us. We go home at night, we read, and we get into a dim light. We don't get bright enough lights. And we want to talk about that. If I'm reading in a dim light, is it going to be harmful to my eyes?
Absolutely none.
False. All right.
People have done before the electricity, before all these lamps, with candlelight, people have written millions of pages.
And explain, I mean, dim light's not going to put a strain?
Yeah. Dim light will give you fatigue. You may not
Fatigue.
have a comfort, but is it damaging the eye physically, like an injury, like a drug? Suppose acid. Somebody threw acid into his eyes, and it can damage. Like that dim light, does it do anything like that? Absolutely none. But it gives, let's say, little bit makes the eye uncomfortable. You said strain is called fatigue. You can get fatigue much earlier where there is not good illumination and not good contrast.
So the same answer would be for computers then?
Absolutely.
Okay. So the same thing with computers. Looking at a computer monitor will not harm your eyes.
Since you said about computer, how the misimpression or the myth goes around, because suppose a person is working with the computer. After an hour or so, he gets tired, his eyes water a little bit, he may be getting little itching, little headache, and all these things are not damaging physically his eyes. Such people, some may need a pair of glasses probably for the computer, because the shape of the cornea is called astigmatism. Still they may be driving well, everything doing fine, but after prolonged times, and another thing, after 40, 45 or 50, our eyes are also a little bit dry, like the skin is dry, and we can get a little dryness. So during computer, you are very interested in what's happening next line. We don't blink enough. In between, if you can blink or just get a moisture drop, if that helps, I think you can get that fatigue a little bit, you can prolong the fatigue and just give a break a couple of minutes, just look at it. If it is happening, then that can help you too. But in any case, computers are not going to damage the eye. If we did, we'll have a lot of blind people today.
You're probably right about that.
Now that he mentioned that, I'm going to be blinking all morning now, thinking about it as well.
Anyway, everything don't too much. I'll tell you that's everything in balance. Yeah.
In moderation.
Yeah.
Kay, one of the things I can remember my mother telling me as a kid As a kid, you see friends who have glasses, or maybe your parents wear glasses. You put them on, and it's blurry, and things look funny. And it may have been just to keep me from ruining somebody's pair of glasses. But, Doctor, my mom would always say, don't wear somebody else's glasses. That's going to ruin your eyes.
Yeah, that's also a myth. What happens if you wear somebody else's glasses and they're not suitable to you? You have little blur, you have headache, you are not comfortable. But you put somebody else's glasses, you are seeing better. That means the other person's problem and your problems are pretty close. These are all called refractive error or focusing defects. So by putting them, you may get fatigue, you may get headache. But do they alter the eye damage? None.
Should we use a drop of any type? Do you think periodically go rinse our eyes out? Is that helpful?
No.
Not
I don't
helpful
think you
either.
should never rinse the eye. The whole concept they used to think, never rinse the eye, but you can do one thing though. In the morning when you get up, all the secretions are stagnant because lids are closed and the eyes do become a little bit dry during the night because brain says, no, it's a waste of time. The eyes are not open. Don't secrete the tears. So the little mucus and all that becomes stagnant. Eyes can be a little sticky. Close the eyes, take some warm water, wash the lid margins, put some warm compresses, 2-3 minutes. That's all you may need.
I'm going to turn it back and make it personal for Dr. Raju. Are all eye doctors the same?
Mostly they're same, but
Most
they
the same?
express differently. Yeah.
In studies, I mean, should we always go to an ophthalmologist when it comes to our eyes and the care?
Yeah. Well, there are, eye doctors means, the ophthalmologist and optometrist. Especially in this country, the optometrists also take care a lot of people in the malls and outside. So they're all very well trained without any question. But they don't go to medical school. So the ophthalmologist training is very different from optometric training. But optometrists also do a very good job, but they did not go to medical school. So some of them, some care they should not and they could not provide.
Okay. I bet a couple other things your mom told you we're going to address as well, like don't sit in front of the TV too close, eat your carrots, all those things we're going to address this morning with Dr. Raju.
We'll have more here on Mon General Health Talk on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
And you're tuned into Health Talk this morning, sponsored by Mon General Hospital. And our special guest is Dr. Vijay Raju, an ophthalmologist. We do welcome your calls, 304-296-0041. It does not have to be about facts and myths. It can be about anything this morning. Dr. Raju will welcome your calls. And I just, before we went for the break, told Dave some of the things his mom would have said. Don't sit too close to the television. It can damage your eyes as a child. And eat your carrot. It does improve your vision.
But carrots are good. Vitamin A. Carrots have green leafy vegetables, and carrot has a lot of it, vitamin A. So eating balanced diet and vegetables, fruits and green leafy vegetables, they all have vitamin A. By eating extra carrots is not going to help the vision.
Okay, so just do some nice vitamins all the time.
Absolutely.
And in general, that will help our health.
Yeah.
You know, Dr. Raju, on this show, we've talked a lot about children and learning disabilities and ADD, and just down the road, we've talked about it all. Can learning disabilities be caused by eye problems?
Yeah. The learning disabilities is a fact without any question. Some children have that, and some of these children may be very bright children too. Even if they have learning disabilities, doesn't mean they look dumb, but they are not. But she should be examined, either an optometrist or an ophthalmologist for eye problems. If they did not need glasses and if they don't have an eye problem, then the problem is you need to have a training or something to help them, but not, vision training. It's not the vision problem. It's much more than that. There are specialists who can take care of that learning disabilities not the eye. It's not the eye problem. If they don't have a glasses problem, or the optometrist, ophthalmologist seen them, and if they did not need glasses, it is not the eye care professional's job to do anything.
But when should we get our child's eyes checked? What's a good time?
You know, that's the most wonderful question. That would be wonderful. Ideally, first examination, if it is done around 3 or 4, even before they go to kindergarten, or at least below age of 5, or if there is a family had some eye problems, sooner the better, any time. The pediatrician can look at it and refer to the specialist. But if that is not done, after 5 or 6, child is doing fine in the school, and his vision is fine, his grades are fine. Those children after that age, if they don't have any symptoms, they can't see the blackboard, they're reading headache, they don't need routine eye examination till they're 40.
Oh, really? They
Yeah.
can go until they start, unless they're having some problems.
Unless there is a family history of eye disease. Normal, if the family is fine, no other problem, not just reading glasses, some other medical problem. After 5th or 6th or 7th, let's say below 10, he doesn't have any problems. After that, I don't think the ophthalmologist and optometrist will do anything except charging them. Thank you.
Can children outgrow problems like misaligned eyes or cross-eyed?
Very unlikely. Very, very unlikely. So if there is a misaligned eyes, sooner the better they must be seen. And so many can be helped in an excellent way today. The technology we have, you should never neglect them, because one eye may be becoming lazy. But if it is that age below 5 or 6, even earlier, ideal, sooner the better. If you catch them, they can be treated very effectively.
As you get older, of course, your eyes change. There's no doubt about that. We all agree?
Yeah.
As we get older, they
Yeah.
change. And is there a magic age to start wearing glasses? Because I'm dealing with this with some of my girlfriends. They don't want to get the glasses yet. They're fighting it. And they can see pretty well, except when they go to look at fine print, and then they have some problems. Is there a magic age or a magic time we need to do it?
Not really, but usually 40 plus. It's called presbyopia. That means your distance is good, but reading you have a little problem. Then you need a pair of glasses, and a lot of other things can be done if they don't want to wear glasses. But incredible things are happening. But those surgeries are not for everybody. That's number one. Mm-hmm. If you don't mind a pair of glasses and show that you are wise, put a reading glasses. That shows the wisdom.
And that's just a place we can go to the drugstore and pick up a pair of reading glasses, right?
Absolutely. That's very important too. But after 40, it's not the eye, but people can develop, 2% of people after the age of 40 can develop glaucoma. Glaucoma is a pressure in the eye, initially no symptoms, but if it is neglected, it could slowly damage the eye. But if it is caught early today, absolutely is less dangerous than an automobile, because we have so many medications, lasers, and surgery compared to 25 years ago. So you should get, when you are having that reading problems, at least go to the professional and get your pressure tested. And if the pressure is normal, at least 2 to 3 years, that is the American Academy of Ophthalmology says, the examination at the 40, somebody gave you a pair of glasses, pressure is normal, everything looks normal, you don't have a family history of glaucoma, you don't need every ear examination. American Academy of Ophthalmology says if everything looks that good, that normal, family history is normal, 2 to 3 years until 60. After 60, you should have an examination every year, because we can diagnose things much earlier and things can go wrong too.
Yeah, after 60, everything changes.
All goes downhill,
It all goes downhill at that point.
But no, be glad you are alive.
That's right.
One of my elders, he recently died at the age of 98, he used to say, if there are no aches and pains, the parts are not working at all.
That is true. Thank you for that.
We're talking about facts and fiction and myths concerning eye care. More on Mon General Health Talk up next.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Talking with Dr. V.K. Raju about myths and facts and fiction when it comes to eye care and the eyes. And Doctor had an eye injury as a teenager, got hit with a baseball. It's a long story, but I have heard that because of that injury, I could develop cataracts down the road. Is that fact or fiction?
Oh, absolutely. If a mild injury, you may not, but anything like a baseball, it will be very slow. Most of the time, it may not develop for quite a few years. But if the injury did not damage the back of the eye, the retina, that cataract can be removed very successfully with an implant. They do very fine, but they will make sure that the retina is okay, that the back of the eye, like a film of a camera.
How has cataract surgeries developed? The technology today has to be much better than it was even just 10 years ago.
And it seems like more people are having it all the time.
I don't know whether more people are having, but today our demands on life have increased. People want to do a lot of things, the driving and reading, all kinds of things. People over computers and things like that. So even with a little discomfort, when the cataract is developing, light doesn't enter the eye very well. So in spite of the best glasses, still their vision is not like when they never had cataract. So naturally they want to see better. So they may be asking for cataract surgery earlier, or the technology improved so much by removing the cataract, putting the new type of implants, their quality of vision is even better. But that patient and the doctor should decide whether they really need it or not. It is an effort or the decision by their physician and the patient together to decide.
Does the cataract have to be completely formed or ripe before you have the surgery?
No. In olden days, when the technology was there, it was easy, less complicated to remove the cataract when it is completely ripe. Today, there's no need to. Actually, we don't want to leave that long because it can have other problems. But if the doctor says that you have a cataract, but you are getting on fine with your lifestyle, you don't drive at night, you drive only a little bit, and you can read the things you want to do. Not perfect, but then there's no need for surgery. You can discuss with them. But if you drive 100 miles a night every night, you may need cataract surgery much earlier than somebody else.
Before we run out of time, real quick, we talked about sitting too close to the TV and children sitting too close to the TV. Now it's all about games and handheld technology and perhaps using their eyes and fingers more than they do their body. Will that in time cause problems with their eyes?
Not really. I have a favorite saying. You said like they're using their eyes and fingers and everything, but sitting too close to the TV is not bad for the eyes, but watching the TV a lot is certainly bad for the brain.
That's right. And
I think that's happening without any question.
Yes,
but that's why parents have to just balance it out, because the TV, what they can see and things, there are wonderful things. The modern technology is wonderful if you use it right.
Dr. Raju, thank you for coming in this morning. Where can we find you when you're not on the radio? In your office?
Or the gym.
At the gym. I know. He's a gym guy.
Yeah.
Thank you very much for being with us.
Thank you. I'm glad to be here.
Morgantown AM is next.